Ronan, for the introduction, and welcome to everyone this evening for joining from home. I'm really delighted to speak today on two topics that I'm very passionate about: golf and really longevity. And I've titled this talk "The Forever Fairway: Strategies for Lifelong Golf." So I'm Ronan Kearney. I'm a consultant sports and exercise medicine physician, primarily based at the UPMC Sports Surgery Clinic in Santry. I also work across a number of other sports, predominantly at the moment, the High Performance Centre in Sport Ireland, looking after athletics, preparing for Paris Olympics. I've also worked European Tour golf and Legends Tour events. I also do a little bit of work in GA, and also I'm a senior clinical lecturer at Trinity College. Where I spend most of my time is at the Sports Surgery Clinic. It's made up of the main hospital and then the sports medicine department, pictured in the icons below. And the sports medicine department is really made up of a team of sports medicine consultants, alongside a full MDT of specialist physiotherapists, strength and conditioning coaches, biomechanists, and we work in tandem with our surgical, rheumatology and radiology colleagues in the main hospital. Working in golf is very rewarding, and I hope that some of the things I've learned from working in that elite golf I can apply to the recreational golfer also. So really worldwide, 60 million people play golf in 206 countries, so huge participation sport. And as we age, participation in previously accessible activities can be challenging. Golf, however, is a very popular sport for the older adult, and it's a really important form of exercise as we age. So really, golf in itself is a recipe for lifelong health. These are some nice infographics that the European Tour had published, and did a lot of work. They did a lot of work in terms of public health and the benefits of golf overall. So physical inactivity causes over 3 million deaths worldwide per year. Golf is a fantastic form of physical activity in its own right. Typically, golf is a form of moderate intensity exercise for most people. By walking the course, you'll generally get 11,000 to 17,000 steps in. If you're like me and you spend a lot of time in the rough, it's probably closer to the 17,000 mark. If you're unable to walk the course, you can still achieve approximately 6,000 steps whilst golfing with a bogey. That in itself still has some great benefits. Research has long proven that the more physically active we are, the greater we live in terms of time. More specifically, the health benefits of golf reduce your risk of multiple medical issues, and diabetes, cardiovascular disease, stroke, colon cancer, breast cancer, dementia, and depression can be reduced by up to 33%. Hip fractures there's a reduction of 65% of hip fractures in golfers as well, so huge benefits to be gained. And a Swedish study found that golfers have a 40% lower mortality rate than non-golfers. So that translates to an extra 5 years of golf. So golfers really do live longer. Anyone who plays golf also understands that not only the physical benefits to your health, but also a great positive boost for our mental health. It has proven benefits in this domain with improved self-esteem, self-worth, and reduction in risk of depression also. Golf is, however, associated with a slightly increased risk of skin cancer. So anyone who golfs out there, just make sure to get your skin checked on a regular basis. And definitely from our pale Irish skin, we need to have our factor 50 at the ready. This is something that we share with professionals on the European Tour in terms of some reminders to both them, but also applies to the recreational golfer in terms of that skin care. So don't leave the factor 50 out of the bag. I suppose golfers can develop a number of musculoskeletal issues, which may or may not be related to the sport itself. And that's really where we as sports and exercise medicine physicians can help. We really strive to keep you as active as possible on the course, as long as possible, so that you achieve all those health and social benefits that we know golf brings. So what are these common issues that we might be able to help with? A recent study looked at the common career injuries in both amateur and professional golfers. And as you can see from the table here, the most common injuries in amateur golfers are really elbow, lower back, hand, wrist, and shoulder. Lifelong golf can most definitely be cut short by injury, so appropriate management of such injuries is essential to getting you back on the course. So for the purposes of today's talk, we'll focus on the amateur golfers, two most common injuries, the lower back and elbow. So lower back pain makes up 16% of amateur golfer injuries and about 41% of professional golfing injuries. More likely to be more common in professional golfers due to the larger forces that generated, as well as the larger repetitive load placed on the lumbar spine, with professional golfers hitting hundreds of golf balls a week generally. There are a number of factors that are modifiable. These really mean that these are factors that can be changed to reduce your risk of lower back pain playing golf. These are a reduction in BMI. Modifiable factors include poor strength, flexibility, and coordination. There are certain swing biomechanics that can lead to lower back pain. And then we know that actually carrying a bag on one shoulder can increase your risk of lower back playing golf. So the golf swing is considered one of the most difficult movements in sports. And to perform a golf swing, there's a powerful action required with rapid rotational forces being transferred to the golf ball, with lots of compressive load placed in the lumbar spine, calculated to be about 7 to 8 times body weight. And recreational golfers have a higher degree of variation in swing, in muscle activation during the golf swing itself. We know that older golfers have age-related muscle changes that influence their swing performance as well. And there's 3 typical swings that have been associated with lower back pain in golfers. So the top early extension, where hips come forward into the hand space during the swing. On the left-hand side, we see that early extension. On the right-hand side, we don't see that early extension. In the middle, we see a reverse C finish on the left-hand side, which puts greater load on the lower back structures. And on the bottom, we see the reverse spine angle on the left-hand side, where we have an overextension of the lower lumbar spine during the backswing. So some of these are suspected to be associated with some lower back pain symptoms. Not to get too technical here, but there are certain swing mechanics that are more common in those with back pain. So it's really important for such mechanics to be identified and really to work closely with your golf professional to address these issues in your swing as part of the management of your injury. Some other potential modifiable factors include flexibility of hip, shoulder, thoracic spine, and lumbar spine as well. So important not to neglect these in terms of your management. It's obvious that strength plays a large part both in prevention and management of golfing injuries. The professional game itself has been transformed over the past decade, with most top golfers now putting a large emphasis on strength and conditioning, and understanding that having such preventions in place reduces their risk of injury and also improves their performance. The same principle can also be applied to the recreational golfer. So there's a number of different potential causes of lower back pain in golfers. Now, we're not going to get into these in detail today, but really any of these can be a potential cause. To really get to the root of the problem of the lower back pain, you need to have a full assessment, both in terms of a clinical assessment, strength assessment, flexibility assessment, oftentimes biomechanics assessment, and at times imaging is necessary. To manage lower back pain in golf, really, if we take a general approach here, education will form a huge part of that. So in terms of making sure that you're aware of what you need to do to improve your symptoms. Weight loss can form part of the management. And as we spoke about, muscle strengthening and control exercises, as well as flexibility exercises, can also be helpful. Looking at your swing biomechanics can be important as well to work alongside your golf professional, assessing that as well. But really early golf-specific rehabilitation would be the most important aspect here. We're lucky enough at the Sports Surgery Clinic to have broad access to secondary management options as well. Not always needed, but helpful at times to create a window of opportunity where pain doesn't prevent progress through exercise rehabilitation. The second most common injury in golfers being elbow, and it's often an overuse injury, more common in females. And unfortunately, the term tennis elbow, synonymous with playing tennis, but actually more common in golfers in 85% of cases. Risk factors for developing elbow pain in golfers, there's multiple different types of reasons. So that can be due to hitting too many balls in too short a time in terms of an overload. Maybe the grip is too tight or maybe it's too slippy. You may be hitting the ground before the ball. or if you try to change your swing very quickly without gradually trying to increase the load. Can also be referred from your cervical spine, so important to keep that in the back of your mind. Oftentimes we'll see wrist flexion changes at impact of the golf ball that can lead to different loads placed on the elbow. The wrist flexor burst at impact is considered to try and increase club head speed, but can lead to some additional forces placed on both the outside, the lateral, and the inside medial part of the lead and trail elbows. So important with golfers with wrist pain that wrist position at impact is assessed. There can be a number of different causes for elbow pain in golfers. Again, that would need to be assessed. As we said, inside of golfer's elbow is that medial epicondylopathy, and outside of elbow pain generally is that lateral epicondylopathy. But really to truly find out exactly what the issue is, you'll need a full assessment, both a clinical assessment, at times a strength and flexibility assessment, and as we mentioned before, biomechanics assessment, and at times then investigations such as imaging can be necessary. Management for elbow pain in golfers depends on the diagnosis itself, but generally will consist of education of your problem, strength-based rehabilitation, looking at the biomechanics again, and again coming back to that golf-specific rehabilitation. Some helping aids can be a supportive brace or maybe even changing your grip size. But again, will all depend on the injury itself. Management options that can be helpful for elbow-related pain in golfers may include ultrasound-guided injection options such as platelet-rich plasma, potentially corticosteroid, or at times extracorporeal shockwave therapy may be helpful. So what is extracorporeal shockwave therapy? Really, it's shockwave. It works by emission of acoustic waves with their shockwaves, which carry energy to the injured tissues. These shockwaves can generate tissue responses that can produce many beneficial effects such as pain relief, increased blood flow, cell growth, and where needed can disrupt calcium deposited in injured tissues. The combination of these effects can lead to improvement in injury recovery at times. Now, what is PRP, or platelet-rich plasma? Really, it's a form of regenerative medicine that harnesses the body's ability to try and increase natural growth and healing factors to try and improve injury recovery. The blood is taken as it would be during a simple blood test, spun in a centrifuge, and then the PRP portion, which contains concentrated healing cells and factors, is injected accurately under ultrasound guidance to the target tissue. PRP is less side effect profile than traditional corticosteroid injections, and in many cases has been shown to outperform steroid in the longer term for many musculoskeletal conditions. So you've managed your golfer's elbow, it's settled down, and now you're trying to ensure you have lifelong golf, as we initially spoke of. So performing a warm-up means that you're less likely to get injured playing golf. Injury is 3 times more likely in recreational golfers without a warm-up. Here are some of the Sports Surgery Clinic's suggested warm-up routines pre-round that you'll also find on the clinic website. I'd recommend that you save a copy of this and bring it into your pre-round routine. You'll often see professionals preparing for rounds hours in advance, and most of the time the rest of us are rushing out of the car to get to the first tee. How many times has it taken you 2 or 3 holes before you feel your body is ready to swing a golf club? So try and arrive early to the golf club, spend 10 or 15 minutes carrying out a pre-golf warm-up and hit a few balls in a practice round. That should help. There've been a few questions ahead of today's talk on osteoporosis in golf, so I better speak on a little on it here. I suppose firstly, osteoporosis is a condition that means your bones have low bone mineral density and are at increased risk of fracture. It's a medical diagnosis made with the help of DEXA scanning. There can be a number of potential causes, but it's very common, and about 20% of females and 6% of males over 50 years of age in Ireland have osteoporosis. It's vital that those with osteoporosis are managed appropriately, medically, often with the help of your doctor and rheumatologist. Resistant exercise plays a huge role in the treatment of osteoporosis and really should be guided by your healthcare professionals. And while golf is considered low impact, individuals with osteoporotic lower back or lumbar compression fractures should really discuss with their doctor before participating. It's crucial to assess the person's overall health status, bone density, pain levels, and functional strength abilities before having that decision. I look after a number of golfers with osteoporosis, and there's a number of different tips in terms of the golf swing that can reduce their chance of further injury. Firstly, working closely with their golf professional to ensure that their golf swing is a good technique. At times, rotating your lead foot to externally can improve some movement through the hip joints and reduce that stress in the lower back. Shortening the backswing can decrease that rotational side bending stress in the lower back. Even something as simple as standing a little bit closer to the golf ball can reduce that forward bending and rotation of the lower back. So there's a number of different mechanical tips and tricks that can actually reduce your lower back stress, especially if you have osteoporosis. These may well help to allow you to continue to golf into the future. So in summary, strategies to support injury-free golfing among recreational golfers include really a holistic approach that includes appropriate management of medical issues and injuries, exercises to improve strength, flexibility that act as both health and performance boosters, as well as injury prevention, working alongside a knowledgeable golf professional on your technique in tandem with your sports medicine physician to help identify any potential swing biomechanics that may lead to future injury. Prepare to fail, fail to prepare. So ensure an appropriate warm-up prior to playing. And most importantly, have fun golfing. Any exercise that you enjoy means you're most likely to do it into the years ahead. And this, as we spoke of, is going to give great health benefits for many years into the future. We're very lucky in Ireland to have such incredible golf courses, and I was lucky enough to grow up not too far from here, County Louth Golf Club. With some of the strategies we've discussed this evening, hopefully you'll be able to continue to spend years ahead in incredible places like this. As we spoke of, golf is a fantastic form of exercise for all. Not only does it add years to your life, but it also adds life to your years. And I look forward to helping keep golfers of all levels, abilities and ages on the golf course and enjoying themselves for many years to come. Thanks very much for taking the time to listen today. Hope you found the talk helpful. If you did have any questions or queries, please don't hesitate to reach out. And I look forward to meeting some of you soon. Thank you.